As we start a new month, we want to focus on those important issues we're going to hear a lot about this month. And November is Epilepsy Awareness Month. And you may not realize, but it's actually a very common medical condition.
Today, Dr. Shan Abbas, an epileptologist with Spectrum Health Medical Group, is here. And Dr. Abbas, let's start from the beginning, or the most basic level. Tell us about epilepsy.
So first you need to kind of know what a seizure is. It's essentially a discharge of nerve cells in the brain that should not be happening. Epilepsy is essentially the tendency of these nerve cells to discharge over and over again when they should not be. And what you see if you're looking at a patient having, or a person having a seizure, is that that manifestation of the neurons discharging.
And so when we talk about the how common it may be, what is the magnitude of this problem?
It's actually very common. It's estimated that there are about 40 million people worldwide who have epilepsy. At least 2.2 million people or more in the United States have epilepsy. And not only epilepsy, if you talk about seizures themselves, there's a 1 in 20 chance that a person will have a seizure during their lifetime. So I think it's very important for everybody to kind of know and appreciate what to do in case they were to see somebody having a seizure.
Yeah, and it's interesting because it's something that you don't have to be born with. I've understood that there are accidents that could even lead a person to having it.
That is very correct. There are certain forms of epilepsy that are genetic, but a lot of epilepsy is actually acquired as we live our lives. Head injury, especially in veterans that are returning from the wars. Strokes can cause seizures, as can brain infections. So it's not just one condition. It's not that everybody kind of fits into the same spectrum. It's a mixture of over 40 different syndromes, as we doctors call them, that can cause the signs and symptoms there.
So if you have one seizure, are you considered to be epileptic?
No. By definition, we have to have recurrent seizures. Most people have to have at least 2 seizures before you'll be labeled with the diagnosis of an epilepsy.
Okay.
So you obviously look at the scientific side of it.
Yes, we do.
Let's look at the science behind epilepsy and what is happening, basically.
So in terms of the seizure itself, it's the discharge of nerve cells. The thing to keep in mind is, like we talked about, there's essentially a part of the brain that will be affected. So say, for example, if somebody has a discharge of nerve cells in a part of the brain that controls movement of one arm, remember that the opposite part of the brain controls the opposite arm. When you have a discharge of nerve cells over there, it's the other arm that you'll see shaking or moving. Some people actually have areas that are sensation controlling that are activated during a seizure, and they'll have odd sensations on the other side.
Right. So in that sense, can it be manipulated and controlled in a certain way?
Yes, it can be. There are many, many different things that we can do to help our patients with epilepsy. We have over 20 different types of medications for certain types of epilepsies that work really well. And it is unfortunate that at least a third of the patients who have epilepsy actually cannot be controlled with these medications. So for those patients, we have different other therapies available. One of the things that we can do for these patients is give them a special type of diet. It's called a ketogenic diet, and think of it as a modified version of an Atkins diet. It's more applicable in children, but it's used in adults as well. There are certain electronically placed devices that go into your chest with wires going to the neck or the brain that can be used as well. And finally, we have surgery available for certain types of epilepsies.
With so many people who are living with this illness, how do you determine that or detect that they actually have it? How do you make that diagnosis?
That's a great question. Again, the first thing that we always rely on as doctors is listening to our patients. So the first part of it is, giving out the history, doing a full physical examination, and typically this will be either starting at your family doctor's office or at a neurologist's office or an epileptologist's office if you are thought to be somebody who needs to be evaluated further. But later on, it will involve typically an evaluation with an EEG, which is a brainwave test, a scan of the brain to see if there's a cause, and then finally an evaluation at an epilepsy center that can determine where your seizures are coming from and if the seizures are because of epilepsy or something else, and what can be done about it in terms of surgery.
Yeah, I was able once to do a story about someone with epilepsy, and they had a surgery and things changed dramatically. And I was shocked at really before surgery what things they could not do. Can you talk about that a little bit and what it inhibits people from doing because of the seizures and the other things that they deal with?
One thing I've learned in my my career is that it's not just about the seizures. There's so much more to epilepsy. So one of the biggest things that we take for granted is driving.
Yeah.
Being on the road is a big responsibility, and if you have a seizure or any episode where you lose awareness or consciousness, you cannot drive for 6 months. Some of the things that unfortunately our patients with epilepsy have limitations to are are being able to, say, for example, swimming in a pool alone or taking a bath in the tub, God forbid, were they to have a seizure and drown.
Right.
And so those are some of the things. But other conditions actually run hand in hand with epilepsy as well. It's actually very common to have depression with epilepsy.
And it's hard to go to school, maybe advanced education.
That's exactly
like
it too. While a lot of patients and persons with epilepsy will be normal cognitively, some people do have, unfortunately, some problems with being able to perform their day-to-day tasks and perform, optimally unless their epilepsy is controlled.
Certainly, we are blessed here in this community to have, you have 4 people in your office, 4 colleagues.
Yes.
And I know that you really want to reach out to the community and provide some great information.
Correct.
And you're doing that at a special event going on at the Frederick Meyer Gardens and Sculpture Park.
Correct.
Coming up in a couple of weeks. Would you like to tell people about that?
It's a great opportunity to network. You'll have 2 of the epileptologists from our group speaking there. It's an event to educate the community about what epilepsy is all about, what's available in terms of treatment, and what to do if you see somebody having a seizure, for example. And there'll also be ample opportunity to actually ask questions.
Yeah, it sounds like everybody could benefit.
Definitely,
from
definitely.
That, then.
Like I said, there's a 1 in 20 chance that you will have a seizure in your life. So you should be prepared if, say, for example, a loved one or has a seizure.
And you also have a great office too. You're located on Michigan Street Northeast, Suite 6100 in Grand Rapids. And if people are interested in getting more information or getting in touch with you, 616-267-7900 or shmg.org/neurology. Thank you so much for being here with us today.
Yeah.
Great
You're welcome.
information.
Thank you.
Very interesting. We'll be right back.
This is 8 West.